Good evening, and welcome to Dell Medical School's Class of 2026 White Coat Ceremony. Please silence your phone and any other devices. The program will begin shortly. Good evening. Please turn your attention to the back of the room as we welcome Dell Medical School, class of 2026.
All right, good evening, everyone. Please, everyone have a seat. Well, welcome to really a terrific event tonight. Thank you for everyone who's here in person and to the people who are with us virtually today. Special thanks to the families of the students who are joining us today. Again, what you do for your students really means everything. A special welcome to the most important people here, class of 2026. And class of 2026, if you wouldn't mind standing up and turning around and giving a round of applause back to those people who love you. And then just a couple of thanks to some of our supporters. So first, thanks to the great medical education team and the faculty of the medical school who are so devoted to the education of our terrific students. Thanks also to the Arnold Gold Foundation for beginning this great tradition and for providing the Humanism in Medicine lapel pins that are on each of the coats today. Thank you also to the community who founded this medical school and to the Travis County Medical Society and board members for their support. And thank you to our many donors, some of which are here with us tonight, who've provided terrific scholarship support to many of our students here in the class of 2026. And many of those are noted in the program that you all have. And then a special thanks, of course, to the Michael and Susan Dell Foundation for their great support of the medical school. And they also provide the lovely coats that our students are going to be getting tonight. They also do something really wonderful, and this comes right from Michael and Susan Dell. Every year, they provide a personal quote that's actually sewn into the pockets of the coats. And this year's quote is, "There's no better catalyst to success than curiosity." In class of 2026, we know that That's why you're here. You're here to help to change how we take care of patients. You're asking yourself questions, I'm sure, already about how we can do just that. So I think it's a great quote from Michael and Susan Dell, and I hope you'll hold that close to you over the next 4 years of school. It's now my pleasure to introduce our keynote speaker for tonight, Dr. Greg Wallingford. He's also the recipient of the Leonard Toe Humanism in Medicine Award for Dell Medical School. This award originated by the Arnold Gold Foundation, recognizes clinical excellence, outstanding compassion, and respect for patients, families, and healthcare colleagues. Dr. Wallingford is an assistant professor of internal medicine and associate program director of the Hospice and Palliative Medicine Fellowship at Dell Medical School. Prior to joining Dell Med, he completed his emergency medicine residency at Stanford, worked as an attending physician at Penn Medicine in Philadelphia, and a management consultant at McKinsey & Company. And he completed his MBA and served as a William Lauder Leadership Fellow at the Wharton School at Penn. Greg, welcome.
Good evening, everyone. Thanks for that introduction. I am excited and honored to be here and to have this opportunity to speak and to share some stories with y'all tonight. Before I go any further, though, I want to say a big thank you to the class of 2026. Thank you for putting on the white coats this evening. Although it's a small act, it reflects a huge commitment, a commitment to a career serving others. So thank you for making this commitment as a class tonight. Your future patients will be so lucky to have you. Over the next 15 minutes, I want to share 3 stories and pieces of advice that I wish I knew when I first put on my white coat. These lessons came from mistakes that I'm grateful for, because I've become a better person and a better doctor by learning from them. My hope is that by sharing these, you might learn from them too. So let's jump in. My first piece of advice is that becoming physician is a journey, not just a destination. So take this opportunity to celebrate and to be proud of yourself along the way, not just when you're done. Almost 10 years ago, when I was in your seat at White Coat, I felt a little bit uncertain about what I was celebrating because I felt like I had just started. And if I'm being honest, I felt a little bit of an imposter syndrome, which went something like, well, I'm not a doctor yet. And admittedly, I was a little bit worried about playing drums at the reception as part of our medical school band, The Associated Symptoms. But the point is, I had already started to engage in destination thinking, which can help us focus on the end goal, but can also lead us to miss genuine opportunities to enjoy the journey that we're on right now. What I didn't take into account were the years preparing for that moment, putting on that white coat. All the hard work reflecting how I wanted to spend my life, the courage it took to embark on a journey that would take at least 11 years. Not to mention all the late nights in the library, spending a summer working in a research lab, applying, interviewing, trying to match schools with my wife, moving across the country. And I think especially important for your class, you've all done this during an unprecedented time. Joining medicine during the COVID-19 pandemic, when science has sometimes been called into question, and when health inequities are more visible than ever. Furthermore, you've joined Dell, a young medical school where we hope to take on these challenges and change healthcare for the better. So tonight, donning your white coats is more than just a tradition welcoming you into medicine. It's an opportunity to celebrate how far you've already come, the hard work that brought you here, and the courage you've shown. So don't forget to celebrate the many exciting milestones that come ahead. Becoming a second-year medical student, completing your clinical rotations, graduating from medical school, finishing intern year, becoming an upper-level resident, becoming an attending. These are all incredible accomplishments, but they're also easy to glide by, and I can tell you that from my own experience. So tonight, before going any further, I just want to share with you, I'm proud of you for making it here. I hope you can take this moment to celebrate how far you've already come, and welcome to this journey. I can promise you it doesn't end when you're in attending. Almost 10 years later, I'm still on that journey with you. The second piece of advice, the little moments of connection with patients make the biggest difference. It's the meaningful connections that make medicine so unique. And our patients need this, but the truth is, so do we. In fact, it was one of these little connections that sent me into medicine in the first place. When I was 15 years old, I was an athlete. I went flying down a hill on spring break and skied directly into a pole and fractured my thigh bone. And minutes later, I found myself as a patient in the ER, scared, in tremendous pain, and overall feeling pretty helpless. When the orthopedic surgeon came over to talk with me, what he did was both simple and profound. He listened carefully. He paused. He looked me in the eyes, and he told me, "I'm going to treat you like I'd treat my own son." Through just those few words, I knew I wanted to be like him. Sure, a talented physician, but more importantly, a wonderful human. Specifically, a kind and compassionate listener, someone who gave selflessly to his patients, and a source of steadiness during challenging times. There have been a lot of unforgettable moments in my clinical career, ranging from giving life-saving medication to a child with an allergic reaction, to, with the help of trauma surgeons, repairing a gunshot wound to a patient's heart at the bedside. Yet the moments that were most meaningful to me often occurred in quiet conversation. The unexpected phone call from a family thanking me for celebrating a mini Christmas dinner with them in the ICU. The hug and tears of joy from a patient who was a huge UT fan when I brought him a UT blanket. Or simply the relief I can see on patients' faces when I say, and I mean it, "I'm going to treat you like my own mom, my own dad, sister, wife, child." Although these moments are brief, they stick with you, and you can practice them right away as a medical student. They don't require any special knowledge or advanced medical skills, just special people like you. And if you practice them, I think you'll find joy and meaning in all sorts of unexpected places. Third piece of advice is to chase your own sunset. When you started at Dell, you joined a group of incredibly high-achieving people. My instinct in these situations, as might be yours, is to double down on working hard and doing what we know best, stretching and achieving. And many of you gravitated towards medicine because you're naturally giving people, because you want to make a difference, and because you're dedicated to a mission. These same traits that are so valuable in training to become doctors and to care for others can sometimes make us lose sight of the present moment. When my wife and I went to residency, we started to do something that has actually made a significant positive impact on me. We bought 2 lawn chairs, we stuck them in our trunk, and we promised to each other that while we were in California, because my wife told me we couldn't stay longer than 3 years, we would always stop at the side of the road, wherever we were, pull out those chairs, and watch the sunset when we were together. Our reasoning at the time was that we wouldn't always be on the West Coast with the opportunity to watch sunset over the ocean. These little moments were magical. We sat, we were present, and they only lasted a few minutes. In these moments, we grew closer despite our time constraints, despite our schedules. And it was in those same moments that we were grounded no matter how busy life was. It was also in those moments that I think we became better doctors, because we found a way for medicine to be hard and meaningful and magical all at the same time. So the last words of advice that I have for you are words of advice for me too. Keep chasing that sunset. It may not be sunset for you, but whatever it is, make moments for you and your loved ones to just be present and in awe. And remember, you may not find a beautiful West Coast sunset every day, but it's in these little moments at regular intervals that will fill your cup which helps you help your patients who need you and makes life feel a little bit more like an exciting journey as you forge your way. So in closing, congratulations. Today, as you put on your white coats for the first time, I hope you can take a moment to celebrate and find joy along the journey of becoming a physician. There will be lots of opportunities if you look for them. Remember that it's sometimes the little human connections with our patients that make us whole, and that you can start making those connections right away. And don't forget to chase your own sunset, whatever, whenever, or wherever that might be. And remember to take off your white coat sometimes. You'll be a better doctor for it. So once again, thank you. It's been an honor. I'm so proud of you all, and I can't wait to see you become the next generation of doctors.
Thank you, Greg. That was really nice. Very good. Thank you very much. My name is Steve Smith. I'm the Associate Dean for Student Affairs. And I want you to all understand that the class of 2026 is a remarkable group of people. This Dell Med School class comes from a variety of backgrounds and disciplines. Academically, they're outstanding. But I'm happy to tell you that their academics are not the only impressive thing about them. The Admissions Selection Committee did an amazing job reading the files carefully. And students, if you ever have imposter syndrome, I promise you, we read it carefully. We didn't make a mistake. And you are going to make outstanding physicians and physician leaders. I'm certain that you're going to help revolutionize how people get and stay healthy. Today, as the audience, we get to watch these students officially don their white coats. In the years to come, they'll wear these white coats during patient encounters as a way of identifying themselves with the proud tradition of medicine. Each coat has a pin to serve as a reminder of the importance of compassion and human care. Our innovative curriculum, especially in the docs course, places students in a small group with a clinical skills mentor. These docs mentors have already been working with these students, preparing them for their first clinical encounters. These groups stay together, meeting regularly all the way through graduation. I truly believe that the relationships built in these docs groups will be a source of pride, connection, and identity for students throughout their careers. During the ceremony, each docs mentor will cloak their own medical students with the mantle of the profession. It's particularly fitting that the student is cloaked by their clinical skills mentor and that they are cloaked together as a mentor group. Today, the mentors will stand to the left of the platform. I'll announce the name of the student so the student can be honored. When the student reaches the mentor will put on the white coat on the student. First group, if you're ready. After being cloaked, each student will be greeted by Interim Dean McCombs, and then the students will take their place on the risers until the class has reassembled on the platform. Dr. Pandian's group. Basil Al-Sad. Landon Ashby. Anna Hartzell. Carolyn Wynn.
That's my roommate.
Chinea Agbana. Dr. Mariquin's group. Roba Abusawe.
That's my roommate.
Kia Abusawe. Oh, no, I'm sorry. I apologize. Kia Baeza.
You better get that white coat.
Lee Horton.
That's my son.
Fatima Khan.
That's my roommate.
Quentin Pham. Dr. Jasundara's group. Gaurav Gomber. Tram Lee. Graham Quinn. Chandana Daitali.
Yeah, that's my sister.
Otavio Zaraga. Dr. Miller's group. Lauren Contreras. Zena Ham. Anish Thalapurity. Leah Varghese. Yen Vu.
That's my boy.
Dr. Bedoya's group. Bridget Fitzgerald. Uma Jacobs.
That's our Ruby.
Hun Lee. Lay. Maria Ramos. Jacob Sutton. Dr. Manja's group. Samuel Burr could not be here this evening. Jackson Bowman. Gabrielle Lee. Tao Lee. Aaron O'Neill. Natalie Rivas. Cameron Shue. Dr. Mulbari's group. Nuha Arfin. Justin Jensen. Natalie Lim. Sarah Yua Tao. John Trujillo. Dr. Sellinger's group. Dhruva Athreya.
That's my brother!
Mamadou Karsey Balde. Duck Huang.
Oh yeah, Doug! That's our brother!
Nima Rahman. Shreya Thiagaraje. Dr. Moreno's group. Rohit Prasad. Layli Safabaksh.
That's my daughter.
Samantha Shulhan.
Go Sam!
Matthew Tang. Corinne Walcott Kirkwood.
That's my roommate! And my wife!
Dr. Hazelhorst's group. Nicholas Goff. Min Truck Luong. Ty McGrew. Yasser Mian.
Yes, sir! That's my brother! Yeah! Damn, he's so beautiful!
Alia Pedersen. Ladies and gentlemen, it's my privilege to present to you the Dell Medical School class of 2026.
All right, hard to beat that, but I want to thank or congratulate the class of 2026 again, and take a moment to move on to a very important part of our ceremony, which is the Hippocratic Oath, which you all can all find on the last page of your booklet. And I'd ask any of you all in the audience that are also physicians to join with me and stand and recite the oath with our students. All right. I swear to fulfill, to the best of my ability and judgment, this pledge. I will respect the autonomy, dignity, and privacy of my patients. I will practice my profession with consciousness. In accordance with best medical practice. I will remember. Some of the pauses are shorter than others. That there is art to medicine as well as science. And that warmth, sympathy, and understanding may outweigh the benefits of surgery and medications. I will not permit bias, prejudice, or other societal constraints to impact my responsibility to my patient. And I will be vigilant in addressing health inequities. I will avoid the traps of overtreatment. And advocate for those without access. I will always put patients and their families ahead of personal economic gain. I will prevent disease and promote health. I will advance health in my community beyond the walls of the clinic and the hospital. I will collaborate with all members of the healthcare team. To provide comprehensive care to my patients and community. I will recognize the limits of my knowledge and skill. and seek the help of others when needed. I will work to improve the quality and safety of the healthcare system. Through innovation, collaborative leadership, and teamwork. I will attend to my own health, well-being, and abilities. In order to provide care of the highest standard. If I do not violate this oath, I will live honored knowing that I have returned to society the great investment and trust it has placed in me. Congratulations, class of 2026. The white coat ceremony is an inflection point in your first year as you really make that transition into starting to think of yourself as a practicing physician. And as I listened to Dr. Wallingford, I walked away with the words, enjoy this journey, celebrate moments with your patients, but always take time to experience joy with yourself and those that you love. So congratulations to you. Thank you all for being here in person and any of those of you who have been here with us virtually. And we'll have some refreshments in the lobby after a few pictures and other things happen up here. Congratulations.